I know that there's kind of the guidelines and the recommendations, and then I think we all recognize that there's real life. And so, everyone that works at the health unit also understands that asking an 8-year-old to isolate is not always realistic, especially if there's younger siblings. So we do the best that we can, and we understand that families are doing the best that they can. I think the fact if both kind of guardians are fully vaccinated, it certainly means that you can continue to go to work. You can continue with activities as normal. The siblings can also kind of continue with essential activities. And really, as long as nobody has any symptoms, you can continue with that. Really, the key, everything changes if anybody starts to develop symptoms. If your child's identified as a high-risk contact, so if there's another student in their class that has COVID-19, so you'll be notified by the health unit. You'll receive a letter from the health unit that comes through the school board. You'll also receive a phone call through Public Health Ontario. So because there are so many students that might be identified as a high-risk contact, health units, so HKPR and all other health units, don't have the capacity to call every high-risk contact ourselves. So there's a central workforce through Public Health Ontario that will do a lot of those phone calls. So you're likely to get a phone call from somebody at Public Health Ontario just to give you further guidance on how to, support your kids in isolating and what kind of the directions are for the amount of time and when they can go back to school. But I think we certainly, we understand everyone's doing the best that they can, and it sounds like that's exactly what you're doing. And so if you've been able to keep your 8-year-old somewhat isolated, that's already pretty impressive.